My name's Seven Song, and this is going to be a series on herbal first aid. And the goal of this class is to give people a practical, hands-on approach to treating people in first aid circumstances. So I want to start off by talking about what this class will cover and some of the things this class won't cover. So we'll start right there. So herbal first aid is a pretty large category. As someone who does a lot of first aid in a lot of different situations, I see many different circumstances. And so for some people, herbal first aid might just be about cuts or bruises or household kind of first aid circumstances. For me, doing first aid at street medic protests and at rainbow gatherings and just large gatherings, and just being someone who knows about it means that people call me up with situations that a lot of folks wouldn't call first aid, but for me, I consider them a first aid situation. And I want to cover, once again, some of the things that I consider first aid and will be covered, and then some of the things that this class won't cover. So this class will specifically cover some of the more commonly seen conditions in first aid. Things like burns, soft tissue damage, wounds, and some kinds of pain, digestive problems. Other things we're also going to cover here are specific herbs and categories of herbs. So in other words, instead of just covering conditions and saying, these are herbs for pain, it's more like these herbs will fit into these categories of pains. And so very often, I'll be breaking stuff down into smaller categories. So if I talk about pain, I might talk about anti-inflammatories, antispasmodics, skeletal muscle relaxants. So the idea is that after seeing this and after having a sense of how to treat first aid and what is first aid, that you'll have different categories in your mind to go to when choosing what remedies you want to give people. It's important to have categories because you won't always have all of the plants that you're used to having in any first aid circumstance. So it's more important to consider what is the first aid situation, what are the remedies that would address it, instead of what are the specific herbs. So a lot of this class will be on categories of herbs. We'll also talk about practical treatments and guidelines through this time. And of course, one of the important parts about first aid in general is when to seek further assistance, and I'll be addressing that more specifically. So what I'd like to do now is discuss what this class will cover and what this class won't cover. So first I'm going to start with what this class won't cover. It's not going to have a lot of depth to specific plants or ways of making plant medicines or gathering plants. So there'll be some overview on the materia medica, the plants used for medicine, and there'll be some overview on wildcrafting and botany, but the focus here is on how to treat specific conditions and how those plants fit into it. So not very much in-depth materia medica. There won't be a lot of pathology, physiology, or pathophysiology here. For me as an herbalist, I find it very important to understand how the human body works. When people are hurt, when they're injured, when they have infections, in my mind, I'm often thinking, how are that specific bacteria or viruses or protozoas affecting them? But since that takes a good background of study, in this class, there won't be any in-depth to the pathophysiology or how things go wrong in our body. Sometimes when it's applicable, though, it'll be lightly covered. There will be very little here on medicine making. So John from Learning Herbs and other sources can tell you how to make different plant medicines. But here I'm just going to be talking about the various kinds of plant medicines and just a very quick overview on what forms I'm using, but not how to prepare them in general, unless we're going to talk about how to gather them in the woods and make them on the spot. We're not going to discuss much on wildcrafting specific plants. And probably most important, this class will not cover chronic health disorders. So I'm not going to be covering Lyme disease or long-term chronic infections. The only time that they will come up is when I talk about exacerbations, that's when something temporarily gets worse. So when I talk about exacerbations of chronic health care in first aid, then they'll come up briefly, but not the long-term treatment. An example of that is if I'm working in a first aid situation and somebody starts having symptoms of their irritable bowel syndrome showing up. In other words, they start to have a lot of diarrhea and constipation alternating over a few days, and they know they have irritable bowel syndrome. I'll discuss sometimes how to help those symptoms, but the long-term treatment for irritable bowel syndrome would be a whole other topic. Some of the things that we will cover here will include burns, toothache pain, using eye cups for eye disorders, mostly people getting branches in their eyes and dirt in their eyes, allergic symptoms, allergies, and respiratory ailments in general, soft tissue injuries, sprains and strains, and animal bites and stings. So those are some of the specific first aid things that will be covered here. So for me, first aid circumstances are the things that I see in first aid are more varied than a lot of other folks see. So when I'm talking about first aid, you have to keep an open mind. What I really mean are just acute healthcare problems, as opposed to chronic healthcare problems. So they could be exacerbations or symptoms arising from a chronic healthcare problem, or just something that, like a bee sting, that wasn't there before and is there now. Some of the other first aid circumstances that I'm going to be talking about are things like colds and flus. So if somebody has an immune condition and they have a cold or flu, it's one situation. But in here, it's very common when you're working an outdoor event or an indoor event that people who are crowded together at events will start to pass around respiratory viruses. So we'll talk about helping with some of those symptoms. Of course, the whole realm, probably the most common thing that people consider in first aid are wounds and injuries and cuts and basic body damage like that. So that's probably the situation that most people think about for first aid, but for me it's broader than that. One of the things that I want to make sure I cover that I don't see as commonly covered in first aid circumstances is the two main things that you see in first aid. So the most common first aid problem is pain. So no matter what the situation is, whether it's colds or flus, which carry, lethargy in their own kind of set of pains, or injuries, or bee stings, or allergic reactions, all of those things have an aspect of discomfort to them. And so for me, it's really important to help herbalists understand that one of the basic tools that anybody needs in treating first aid is how to help ease pain, physical pain. Along with physical pain, there's often trauma involved, especially things as dog bites or wounds or injuries, places where you hurt yourself suddenly. And so two things that are really considerable when doing first aid is how to help with physical pain, how to help with the person having all their injuries, how to help with the bee sting. But also just remember, when somebody gets bit by a dog, it's much more than just teeth in a hand. That person has just been attacked by something, and often they're at a heightened sense of anxiety. And so in order to treat them and help them feel better, one thing you want to do is lower their stress levels, lower their anxiety, and just help them feel more comfortable both physically and mentally. And as most of us know, there's not a lot of real delineation between the physical pain and mental pain. Often if you decrease some physical pain, some of the mental pain, trauma, anxiety, reduces. And at the same time, sometimes when you reduce some of the mental pain, some of the physical pain gets lessened as well. So this is a course on herbal first aid, but it's going to cover a lot of things that often people don't consider when they talk about herbal first aid. So that's the first part of this, and it won't cover chronic healthcare problems. What I'd like to do now is talk a little bit about myself, my school, and how I got involved in first aid circumstances. So as said, my name is Seven Song, and I've been practicing herbal medicine to some extent or another since about 1981 when I went to my first herb school. The reason for me to practice as an herbalist is to combine a couple of different aspects that I love to study. So one thing is I just really like to help people. It brings me a lot of pleasure to help people with their symptoms and to as much as helping people with their symptoms, I like to educate people to understand what is wrong with them so they can help put off having the same problem over and over and over again. So that's more of a teacherly part of herbal medicine. And then the clinical herbalist part has to do with just treating people and giving them the correct herbs and helping them stop the problem from occurring over and over again. The other part of it is that I consider myself a naturalist, and specifically more in the botany realm. So I'm somebody who spends, when I'm not around humans, I spend a lot of time in the outdoors. I spend a lot of time looking at things like toad eggs and birds at the bird feeder and plants in general. And as a botanist and trying to identify plants, it's just a natural good combination to have this love of science and this love of plants, and then to like people and to bring these two things together. And I think so herbal medicine has just been a really good match for me, especially since I feel uncomfortable giving most people toad eggs as medicine. So it's going to come back to plants for me. I want to say right here that if people are interested in more information, I have a website, and that is sevensong.com. It is a website about my school, but there's lots of free handouts. It's just lots of information. Also, I have a website, a Facebook page. If you're interested, it's Seven Song spelled out, as Facebook just doesn't allow me to write the number 7, S-O-N-G. And then I put up a lot of different photographs. I'm laughing because recently it's mostly been about toads. Once again, I love amphibians. And so if you're interested in following, just become a friend on Facebook and join the amphibian club. And there's also plants and first aid circumstances and occasional pictures of the students. I've had an interest in first aid for about 15, 16 years now. And we can kind of divide people up into two right away. And so some people, when they see a first aid circumstance, they get squeamish and want to run away. And I will tell you, if you're watching this, if you're one of those people that runs away from first aid circumstances, to first get a cell phone, so that way if you're running away, at least you can call for help. And secondly, that probably you're not going to be a first aid worker in the same way, because there's going to be a lot of pain and blood involved and gore. For those of you who, when you see things go wrong, you're drawn to it, you are glued to it, you can't leave it. So if you see somebody fall down, your instinct is to go over to them and to help them. Or if you just see a bad accident, you want to do the most you can to help those situations. And if you're around a lot of blood, and don't forget, there's always a lot of pain and anxiety associated. If you're squeamish, not just with physical stuff, but with people's emotions, first aid is also going to be difficult, because most people are not very happy when they come to see a first aid worker. They're in a trauma mode. So for some of you who feel like these situations ground you, then first aid might be in your cards. And so I am one of those people. I've always been somebody that when I see especially physical messes go up on an injury, that I feel like I want to help. And over the course of the past 15 years or so, I've just developed a lot of skills. And the problem is that herbal medicine is not rife. You don't see a lot of books that have in-depth first aid studies. And so over years, I've just been practicing and trying to figure out what works and what doesn't work. To put it differently, herbal medicine has been used for first aid since we were bipedal, meaning on 2 legs, and way before that. So first aid circumstances, injuries and infections, that's been a part of the human experience forever, right? Before we were humans, we had injuries and different circumstances that we had to work with. Back in those days, there were no modern drugs, and so of course we all used plants. And so one of the crazy questions about herbal medicine is sometimes we'll say, does it work? Now, does herbal medicine work for all circumstances? Probably not. But in first aid in specific, there's this huge history of people all over the world using plants to try to mend their bodies from first aid problems, meaning cuts and wounds and infections and pain, and probably also for the mental afflictions that happen in our species. So I have an interest in all of that, and for those of you who are watching that you also have this interest, I just suggest getting involved, practicing, learning your art, and then there's other smaller things we'll talk about how to work with patients. There's this very large gathering that happens every year in the United States for the past 40 years, and that is called the Rainbow Gathering. So the Rainbow Gathering is very mixed. I have very mixed opinions about it myself, but we set up a large first aid area outdoors at the Rainbow Gathering. It's a free event. It often has up to 10,000 people, which is a lot of people. It's usually about a mile or so from the nearest road, meaning that there's no quick ambulances in or out of there. If you're interested in it, the website is welcomehome.org, welcomehome.org, and then you can learn more about that. But I've been going for a long time, and the main reason that I go is to do first aid. And it is amazing as a place to practice first aid. First, because we're not in a city area where you can immediately have help come, like ambulances or doctors or there are doctors there sometimes. But the circumstance is that emergencies have to be treated right away without having the access to modern facilities that you generally have if you're at home or on the streets or even in a street protest. You're protesting something and get injured, no matter whose side you're on, right? There's an ambulance not very far away. Now, of course, this just means the United States and Canada. I'm talking about rich nations right now with lots of access. But that's what the focus of this is the work I've done, which is primarily in the United States for this kind of first aid work. So back to the Rainbow Gathering. So the Rainbow Gathering is always in a national forest. This year, 2011, it's going to be in Washington State. But at the Rainbow Gathering, with that many people gathered together, you get a lot of injury. Not only do you get injury, but you get communicable diseases just because people are sharing food, people are sharing clothing, people are sharing stuff. So good and bad about that. But if somebody has lice in their blankets, lice gets passed around. I'm not going to cover lice in here. If somebody has a respiratory infection and a cold or a flu, and they traveled in a car to get to the Rainbow Gathering, 5 days in a car with somebody, that respiratory virus has a good chance of jumping around from person to person too. And also, it's outdoors, and you just have all those other places where people get injured outdoors. I'm not really recommending or not recommending the Rainbow Gathering. What I'm saying right now is that after 15 years of working the first aid station there, I've seen a lot of hardcore injuries, as well as just the normal stuff, branches in the eyes and bee stings and stuff that might not have any bad sequelae associated with it. The whole thing is basically national forest that's going to try to be not too lightly scathed over in order to have a situation where 10,000 people can gather and just be there doing whatever it is that they do. I go there to give plant walks every year and to do first aid. So that's the Rainbow Gathering. I've also just worked at music events. And at different music events like Grassroots here in Ithaca, there's also, you just see your normal injuries from people dancing and not getting enough sleep and all the injuries there. These are also places for you to get experience. It's, in order to be a good practitioner, it's important to gain experience. When you treat people in any circumstance as a practitioner, as a healthcare worker, people listen for confidence. And initially you will have less confidence, but over time, as you treat people, and as you treat people well, your confidence will grow. And that confidence helps make people feel comfortable. And when people are comfortable, it's often easier to treat them there as well. A whole other note that is really important. If you want to learn how to practice first aid, there's one thing you should start doing right away, and by right away I mean tomorrow, the next day, next week, and that is carry a first aid bag. As soon as you have a first aid bag, and we'll talk about what to stock it with, you put 10 herbs in there, and you keep that bag on you all the time, you will start treating people. So what happens now is you go to a party and it's some outdoor event and the hummus is sat around for too long and now a couple of people are puking from the hummus. Right, and so, because let's say it's a wedding and it's 3 days into the wedding and people are eating some food that's a little bit rancid and old at this point. And you think, wow, if I only had activated charcoal right now, if I only had some echinacea right now, whatever the herb is, but if you have it, then you can start treating people and then you will start to learn what herbs really work and how to use them. So what I'm suggesting to everybody watching this is to make a small first aid bag and just keep it in your car and travel around with it, and you will start to treat people. There's always people getting stung. There was always people hurting their feet. There are always people getting colds and flus. In order to learn how to use the herbs, you have to practice. In order to practice, you have to have the medicines with you. So it's simple. Make your own medicines. It's much less expensive. I should say that I never charge for my services, so it will cost money, right? There's the time spent into it if you want to count that, but just the medicines themselves. So start making your own medicines. And through this course, I'm going to be talking about different plants that are helpful, and just start to gather your resources and make these medicine bags right now. He or she who carries the first aid bag gets to treat. Another place that I've gathered experience is I work at a place called the Ithaca Free Clinic here in Ithaca, New York. And that's a whole other circumstance. In the Ithaca Free Clinic, most of the people who I see have chronic healthcare problems. So I won't talk much about that, but if you're interested in a model of free medicine, incorporating doctors, chiropractors, acupuncturists, I would suggest going to the website, which is ithacahealth.org. So Ithaca is I-T-H-A-C-A health.org. And we're a free clinic that's been serving people, thousands of people now, for over the past 5 years. And it's one of the things I feel most proud about doing in my life, is making herbal medicine accessible and affordable. I want to also include, because it's important in my life, and I started off with this, is that, you know, if you're a naturalist, botanist, if you're interested in the natural world, let herbal medicine be a lead in that too. So it's, the people part is interesting. But, you know, people, working with people all the time, just carries its own heaviness. So I suggest, while you're doing herbal first aid, while you're working these circumstances, get away from people every once in a while and just appreciate where you are. If you're outdoors, just start looking at the insects that are around you, start looking at the amphibians that might be in some of the waters, or lizards if you're in the desert. I'm really suggesting to take mental breaks from treating people at times, and how I do it, so I'm suggesting it, is just looking what lives around me that's not just human. I wanted to talk a little bit about my views about something that could be controversial here. And that is holistic medicine, and the quotes are on purpose here, versus conventional medicine, and synthetic drugs versus herbal medicine. I'm someone who believes strongly in all the different kinds of medicines that are available. Whether they're antibiotics, or surgical interventions, or any of the more modern techniques, for me, there's no good or bad medicine. There's medicine that works and medicine that doesn't work. Now, our medical system here in the United States is clearly skewed to downplay holistic treatments and to upplay what could be very expensive medicines. So I want to be clear that this is not a class. I am not a person who is against modern medicine. I am wholly for modern medicine. Unfortunately, as we all know, the big pharmaceutical companies, well, just pharmaceutical companies, have to make a huge profit because of the way that the whole thing is set up. So the system is horrible. The medicine itself is good or bad, depending on whether you need it or not. So important in this is to understand that there are times when you definitely want modern medical intervention. There's just nothing wrong with it. It's going to be expensive. Pretty much it's always expensive. So when I say there's nothing wrong with it, what I mean is you should not have a mind frame as there's something automatically wrong with it because it's modern. Modern medicine, like all things, derives from ancient practices, right? So we keep learning and growing and expanding. And now we've reached this new place. Unfortunately, greed and authoritarianism shows up here. But this is not a class on how to avoid modern medicine at all costs. This is a class on when to use herbal medicine practically and realistically, because that's how I choose to do this. So, and also on the idea of natural drugs and synthetic drugs. To me, it's just a matter of what's accessible and what's affordable. As an herbalist, I like to give herbal medicines because that's my realm. I'm not trained to give pharmaceutical medicines. And I'm not interested in being trained in giving pharmaceutical medicines. I am interested in using herbal medicines to the best of my knowledge and to continually learn that. Once again, it fits in with my naturalist tendencies, my botanist tendencies. And so one of the considerations that I think that gets overlooked at times is that herbal medicine could be much more expensive than modern medicine. So I want to talk about words for a second here and come out of it. So I use conventional medicine and modern medicine. I don't like the word allopathic medicine, primarily because I never meet any doctors who have any idea what that word means. So I'm saying this word that people are just looking at me with quizzical faces. Secondly, it's pejorative. I work with doctors in a free clinic. They're good people doing what they can to help people. So I don't want to have like a downcast view on people trying to help people. Yep. So I want to come back to this. So modern medicine sometimes could actually be less expensive than herbal medicines in some specific circumstances. And that's often for infections. So I like to use herbal medicines. It's my proclivity. But I do want to say that if somebody needs echinacea for some kind of respiratory virus, let's say a cold or a flu, and so they want to use the echinacea to stimulate their innate and adaptive immunity to help with it, they might have to spend, if they're in some town, $10 for a 1 ounce bottle. That might need 3 1 ounce bottles of echinacea to get through a virus. That's $30. Antibiotics, and by antibiotics I mean conventional antibiotics, can cost $3 to $4 for a month's prescription. So I'm not saying that antibiotics are better or worse than herbs. I am saying that sometimes they're affordable, and you just have to take that into consideration. If you're treating people, the goal of being a healthcare practitioner is to make people better. That's the goal. My goal is not to make everybody believe in herbal medicine. I'm an herbalist, and I'm going to use herbal medicines. But my goal is that they get better in the best way possible with affordability, accessibility, etc. And so if somebody has no money and they no herbs around, and I say, well, you should buy echinacea, and they can't possibly afford enough echinacea for their healthcare problem, then antibiotics, especially if they go to a free clinic and they get the prescription, then they go to their large drug store, and then they get their generic antibiotics for $3 or $4. So there are side effects to antibiotics sometimes, but that's not the point here. The point is you have to consider what's best for your patient, not trying to foist your opinions on people at the expense of their health. What I want to do now is kind of feels a little awkward, but I feel like it's important. And that is I want to give a disclaimer to this course. There is no FDA or anybody else here to tell me to do this, but I feel personally it's important to let you know that it's important to give you a fuller understanding of what you're venturing into when you're treating people. A lot of what I'm going to be talking about here are real life circumstances for me and where herbs have helped or not helped. One thing that's important to know is I'm as likely to say situations where I didn't see herbs work as well. Maybe not quite as likely, but some of the time it's important to know that herbs don't always work and when I've seen them not work as well. But you, the person I am pointing to right now, you are responsible for your actions. I'm not responsible for your actions. John, sitting behind the camera, is not responsible for your actions, nor is anybody else. So the most important thing for anybody to learn here is how to apply critical thinking in all of the circumstances that you come up against. So critical thinking just means thinking about it. So instead of just giving an herb wantonly and just not even thinking about it, think about the situation. Thinking can take place in seconds, right? So not everything needs long deliberation. But you are treating people and you can make them worse. It's the reality of healthcare. And that reality will stay with us. The better you get, the ratio of how much more you will help people will improve. But I want to be clear that you're watching this, and I'm going to talk about herbs, and some of those herbs you're going to try, and I'm not really sure what's going to happen when you try them in the specific instances that you do. So please learn as much as you can from this. But also please take into account that you're responsible for other people. You're, as a healthcare practitioner, as somebody working with people, you're taking on a new role. It's a fantastic role. It's a life-affirming role. It feels freaking good. But it can feel freaking bad when, all of a sudden you gave that person herbs for another problem, all of a sudden they have diarrhea. So in your mind, when you're treating people, In any healthcare profession, in your mind, it's important to think, why am I doing this? So if you're getting nervous and the situation is uptight and you're not really sure what to do next, in your mind, you should be thinking, I am here to help. How can I best do that? And that will relieve some of the tension that happens in these circumstances. Things to consider is every situation is different. And not only is every situation different, but we are built differently. So we could just take antibiotics as an example, right? Some people take an antibiotic, meaning a conventional drug, and they basically take it, they get better, and they don't have any side effects at all. Other people take antibiotics and they get diarrhea and yeast infections. Basically they look pretty similar, these two people, but they have different reactions. Well, that happens with plants too. So if somebody has a really bad headache and you give them skullcap for the headaches, some people, their headache might get better with skullcap, and for other people, it might make their headache worse. So we're going to talk about how to mitigate that, how to try to lessen those, how to use herbs in a way that you will do less harm and trying smaller amounts originally. Very importantly, health can change very suddenly, especially in some first aid circumstances. So as well as taking responsibility for the short term, they come to you and you help them. In some ways, you're also considering their long-term health problems. They got stung by a bee and now it's just red and angry. It could get worse. They can have a much worse allergic reaction later. So learning how to monitor or how to set up that person's individual circumstance so that the situation doesn't get out of hand later. There are legal and ethical aspects to healthcare. But what I'm talking about now is just a kind of an on-the-spot decision-making, critical thinking parts. So to say it again, when you help people, in some ways, you're starting a bit of a legal contract. Now, you're not signing anything, but you're saying, I'm going to help you, however you help that person. And if things go wrong, if things go right, most likely the worst that happens is you start getting a Christmas card every December with the person telling you how much you helped them or something very kind like that. But in other circumstances, things can go wrong, and it can go wrong. They might not see it wrong, but their family might. So you just have to think, I'm helping them, and what might come down the alley later. Personally, I just continue to help people, hoping that the best continues to happen, meaning that even if the situation gets worse, the person assumes their own responsibility, because the patient has responsibility too. So that the patient, the person I'm working with, is taking responsibility, and I'm talking to them while trying to help them to understand that I can't be held responsible for everything that happens with their body as I'm trying to treat them. It's a little bit disconnected. Previously, I just said that you do have responsibility, but it's important for you to also make sure that the patient realizes they have some responsibility. The quick and dirty on legality is, the more licensing you have, the more legal responsibility you have. So then you're just some guy who's helping people, or some gal who's helping some people, or some trans who's helping some people, right? If you're a nurse and helping people, you actually have what's called a scope of practice. Generally, some situations get covered anyway, but just be aware that if you're a doctor giving herbs or a nurse giving herbs, potentially you could be seen as acting outside the realms of your scope of practice. In all the first aid circumstances I've been in, I haven't seen that be a problem yet, and I've been in lots of them, but it's just something to consider. As far as getting sued, this is the United States. Anybody can sue anybody at any time. So as a human being, if you're alive, even actually I think if you're not alive, you can still get sued. But in general, it doesn't happen very much. And as long as you feel like you're doing a good thing, it's just unlikely. But I guess the thing is, if you're worried about getting sued, if you're just constantly worried about treating people, and you're worried about lawsuits and worried about people getting sicker, you're just never going to be able to do this. So what you have to do is, I'm saying some of these things because they're real considerations that some of you might have, but I'm also saying that you just have to push through and practice. And in your mind, you got to be thinking, I'm trying to do the right thing. I'm not here to market myself. I'm not here to make money. I'm not here to get a bunch of adorations. I am here to treat people. With that in your mind, all these things get a little bit simpler. Because even if somebody gets angry and they start saying, you shouldn't have done this, now I have a scar, you can at least think, well, I was trying the best I can, and you've probably have given them other options, which is a good thing for other people to have. So that's an overview of me, an overview of some of my belief systems, and also an idea about, a very quick idea about legal responsibility. I want to say that as far as legal responsibility, Canada and the United States are slightly different in what are called Good Samaritan laws. And Good Samaritan laws basically say that if you help people under dire circumstances, generally you're protected. But there are state-by-state laws, and if you want, you can go up and just look up the Good Sam laws, but they're not really invoked too much. Not that often do people try to sue or bring people to court for trying to help them. Judges and juries are human beings, and if they feel like somebody's just bringing some frivolous thing against somebody just for revenge, it's often not seen really well. Or that's what I assume is true, because I just don't usually see these kinds of things make it to court. So this has all been an introduction to this course, maybe a kind of disordered introduction, but it gives you a sense of what I'm going to cover. So some of the things I'm going to cover are going to be acute first aid circumstances. We're going to avoid chronic healthcare conditions. Talked a little bit about who I am, what I do, and who makes a better first aid person, meaning somebody more drawn to blood and guts. And as this course continues, of course, it'll go from the more general themes of what I'm covering now and start to cover the specific first aid circumstances that often many people will see. I also wanted to add that I do run an herb school, so it's called the Northeast School of Botanical Medicine. If you like my teaching style, if you like irreverence, if you like sarcasm, if you like a scientific approach to herbal medicine, so scientific is a whole other quagmire to get into, but scientific in a broad scope, not scientific in a very reductionistic model. This might be a program that works for you. If you're interested about the school, you can keep watching these videos. They'll give you a sense of who I am. And also you can visit the website, which is 7song7 SONG.com. And so this will end the introduction. After this, we're going to discuss wildcrafting and botany. And I want to show people some of the basic tools that are useful for gathering plants and some reasons to study botany, though both of those will just be covered quickly so we can move on to the meat of this class, which is going to be how to treat people.